Hi everyone. Right, today I have got a balloon background. I don't know how many balloons you can actually see, but to celebrate the fact that actually we have confirmation that our vaccine is being delivered next Friday. Now, we don't know what time that vaccine is going to be delivered. We've only been told it's between 8 in the morning and 6:30 in the evening. We don't know when, so we cannot run a clinic next Friday because we're uncertain about when to deliver that vaccine. However, we will be delivering all day Saturday and all day Sunday, which is brilliant. And I'm pleased to be able to tell you that the appointment times are from 9 until 1 on Saturday and Sunday, and then from 1:30 until 5:30 in the afternoon, both on Saturday and Sunday. The appointments are 5 minutes long, and they're in batches of 5 with a block because the clinicians or the vaccinators will need to restock their supply of vaccine in that period. So what I want us to do is talk about your flow of how you'll walk through the building to access services, because I can now confirm that. However, before I do that, what I'd really like to show you is the letter that we have sent out to every single patient who is aged 80 or over today. Okay, I'm going to show that letter in a minute, okay, so that we can talk about it. Right, here goes. So everybody should be able to see this letter. Now, it has been posted first class. Hang on, I'm going to shake my head. My producer's shaking his head at me. What's happening, Stuart? Oh, right, sorry, okay. So, sorry, we had a slight delay then. Don't really know what was happening, but let me start again. This letter has gone out to every single patient aged 80 and over from both Avon Valley Practice and Sarum Health Group. You can see that it clearly tells you when your appointment is and the time of that appointment, okay? It gives really important information. Only come to this appointment if you are well. If you are not, please don't come. If you're supposed to be self-isolating, please don't come. Do not worry, we will book you another appointment when we get more vaccine, which will be very soon, according to NHS England. Okay, before you arrive, please make sure you go to the toilet. If you need the toilet while you're with us, it's at the other end of the building and you may miss your slot. So if at all possible, please make sure that you go to the toilet before you leave the house and before you get to us. Okay, now, some of you will require people to be with you. That's absolutely fine. However, we do have to be aware of numbers. So only carers or for people who cannot get through the building on their own should be attended by someone else. Otherwise, please wait in your car. Drivers, wait in the car, wait for them. We promise we'll look after every single person. Importantly, wear the right clothes. Okay, we want you to wear a short sleeve top so that we can easily get to your upper arm. That is the easiest way to vaccinate you. Please don't wear lots and lots of clothes and you have to take them all off to get to us. All right, you will not be waiting outside. Now, remember, you will also need to wait 15 minutes after you've had your vaccine before you're allowed to leave. Now, don't worry, when the clinician gives you your vaccine, they'll also give you a little kitchen timer, a wipe clean one, and it will be counting down to 15 minutes. And until that beeper goes off, you need to stay with us in the surgery. So you'll be in the waiting room, sat, and there'll be a video playing explaining what again has happened at your vaccination, and there'll be marshals on site around you, but we have to make sure that you are okay and you don't have a reaction to this vaccine. So please be patient with us. I know it's annoying, but it'll be great if you can stay and just appreciate the 15 minutes of rest. Now, you cannot be vaccinated against coronavirus if you've had any other vaccine in the last 7 days. So from today onwards, if you have a vaccine, you will not be able to have the coronavirus vaccine on Saturday or Sunday of next week. So please if you have to have a vaccine, absolutely you've got to weigh that up, but probably best to discuss with your clinician. We have to weigh up the risks. Whatever the time of your appointment, please make sure you just arrive on time. Do not arrive early. That's where there will be a queue of people if you do. Okay, we're very much trying to get you in and out of the building as quickly as we can, and we're aware that the weather is atrocious and we do not want you waiting outside unless absolutely something requires us to make that happen. However, avoid that by not arriving early, just arriving on time. And last but not least, and I know some people have asked, is that what to do about public transport, and we can tell you that the number 4 gets to Lark Hill every 30 minutes. So if needed, please do that, although you will have to check Sunday times to be able to do that. So hopefully, as you can see, this letter is going out to everybody. It's been posted first class and they have gone into Royal Mail today. Therefore, if you do not get a letter by Thursday, please call us. But please don't call us on Tuesday or Wednesday because it can take time. However, by Thursday, if anybody aged over 80 has not had this letter, please contact us. You do have an appointment booked, so please don't fret about that. But of course, the problem is you don't know when the appointment is. So we need to address that and make sure that you know. So I'm going to close this letter now and come back to my screen with me. So hopefully that's giving you some reassurance about what is happening. Now, we have sent that letter. The reason being we've chosen this method today because our surgeries are absolutely inundated with looking after very poorly people with COVID. We have lots of people contacting us because the prevalence of COVID, as we all know, has gone up extremely and we don't have capacity. So those letters have gone out today so that everybody knows when you need to come. And the great thing about this is that we've had enough notice to be able to send letters. So that would be wonderful. Now, I'm going to share my screen and show you about the patient flow next. I'm not sure whether my producer has actually shown this screen to you or not. Stuart, are you showing the map? I can't tell from the screen. Yes, you are. OK, hang on a minute. He is. Right. So can you just go back to me a second, Stuart? No? OK, so no, he's not going to send it back to me. So bear with me. Right. OK, this is the plan for the day. Now, those of you who know Lark Hill, you'll be looking at this thinking, hang on a minute, we're coming out the entrance. And that's exactly what is happening. So what we've got here is that we are working the building in reverse. So indeed, instead of going into the entrance, which you've got large double doors, indeed that is going to be the exit. So arrive though, as you would from the car park, as if you're going into the building. However, keep going around the outside of the building, up back towards where the main road is, okay? And there is a fire exit on your left-hand side. And you will be going into this fire exit entrance. There'll be lots of marshals on site, and I'll talk about those in a minute, but you're going to be going through the kind of the side entrance into our building. You'll be walking through past some clinical rooms into an area to check in, whereby we'll obtain your information, mark you as arrived on your appointment, and register you on the IT system called Pinnacle, which is going to be used to record your vaccine. From there, you are going to be moving into the waiting area where you're going to be vaccinated. Now, see these little boom signs that I put on the map? That's where you will be sitting. Now, those of you who have had flu vaccine this year will know that you sat in the doorway of the consulting rooms. That is going to happen again. So whether or not you had your flu vaccine with Avon Valley or whether you had your flu vaccine with Sarum Health Group, OK, the same applies. You'll be sat in the doorway having your vaccination. OK, this is the safest place for you to be. And in each consulting room, there will be a vaccinator who is either a nurse, a doctor, indeed we've got consultants. We have all sorts of people vaccinating you, but they are all professionals. They're all registered with their professional body and are able to vaccinate. They will be working under a legal document called a PGD to be able to vaccinate. So they will be diluting and mixing and drawing up your vaccine to give to you. Meanwhile, there will be an administrator in the consulting room who will be recording the information that and the progress that vaccinator is undertaking, so that your records are updated live with what is happening. You are going to be asked about, you are going to be asked to give consent. There is going to be what's called a caution checklist undertaken to make sure that you don't have any known allergies to any of the constituents of the Pfizer vaccine. So as I spoke again last Monday to tell you, it is going to be the Pfizer vaccine that is administered this week on the weekend of the 16th and 17th of January. So once you've sat with your vaccinator and had your vaccine, you're now going to be moving into the waiting room. So you can see that nice big arrow in the middle of the screen. That's where you'll be moving, holding your kitchen timer. And you'll be sitting in the waiting room just to the left by a large window and courtyard, good air for ventilation. So we'll have the windows open to be able to do that. You'll sit there for 15 minutes, or indeed the remaining time on your kitchen timer, and then you will leave out through the latter arrow down through what we know as the entrance of the building. That's where you will be leaving. So you can see it's a nice clear flow through the building. You will be in a health environment the whole time. Indeed, on this map, you can also see where our medical emergency kit will be, and that is in the area next to the vaccine storage and preparation site. So it is there's easy access for all the clinicians, whether you're in a clinical room or in the waiting room, in case there is any adverse effect. Okay, the chances, remember, are very small with this, but there is still a chance. So we have our kit on hand to make sure that we are ready and able to help you. Okay, now once you leave the building, we will have a number of stewards who are there to be able to assist you, maybe to go back to the car in case your driver is still in the car, generally to help you out of the building nice and smoothly back to your cars and home. Okay, so we really hope that this is a smooth, stress-free environment for you to work in. So really good news in terms of all of this is that we have all of our clinical team confirmed. So we have a full stock of staff ready and able. We have all of our administrators ready and able, and indeed we have a number of volunteers as well. We've had lots of people already come forward, and so therefore we have a cut-off date of 6 o'clock on Monday to make sure that those people who have come forward first kind of can find out which shifts they'd like to do. However, if we have any gaps and those I can't fill, I will probably be holding another live Q&A event with you, calling for help. Now, my producer is trying to tell me something, but I can't read what it is that he's trying to say, which is always a bit tricky. Can you put it into that? It's all blurred, Stuart. I don't know what you're trying to tell me. I'm so sorry. You're going to have to be clearer to me. Camera back to you. Oh, right. OK, sorry. So he's asking, do I want the camera back to me? Well, as long as I'm on the screen and the map is next to me, that's absolutely fine. Cool. So sorry about that interlude in terms of working that out. So it's been quite a long week, to say the least. Anyway, back to the show in hand here. What we've got is what I was currently talking about was about volunteers. And so we do have a number of volunteers. We hope that we have enough for this clinic. I expect that hopefully I will be coming back to you saying that we've got more vaccine for either the following weekend or the weekend after that. We don't know yet, but we do know that the vaccine supply is increasing, and as it increases, so our demand will go up to be able to, well, our demand as in from the NHS England will go up, which is great, and we can meet that. And indeed, we will be calling for more supporters to help us. So I really hope that I have explained what's happening, and I'm going to just look at some questions now to see what's happening. Right, okay. Now, somebody says, John says, I've been sent this link, but I'm only 63. Am I due a letter? No, not right now. As I've talked about, cohort 1, so the first people in our population to be vaccinated are those people over the age of 80, those people who are health and care workers, and those people aged under 80 who live in a nursing home. Now, that's really good. Now, you're 63, so therefore you are going to be vaccinated at a later period in time. So the letters for this vaccination clinic that is happening on the Saturday the 16th and Sunday the 17th of January have been sent out today only to patients aged 80 and over. We've used this method of communication to suit this population group and also given the mass demand on our normal services Monday to Friday due to COVID. Okay, we are in a pandemic that is getting worse, and therefore we have to look at what we do and how we do that. So hopefully, John, I've answered that. So it says here, do we still have the option of choosing to be vaccinated at a vaccination? Well, it will be a mass vaccination site in Salisbury. Travelling to Larkhill will be inconvenient. It's up to you. The vaccination site in Salisbury hasn't gone live yet. We're not actually still allowed to talk about it. So you've got to decide what you want to do. But we know what we can offer, and it's up for people to decide. If you've been given an appointment and you don't want to take it, please cancel it. Don't just leave it. On Saturday and Sunday, we will be ringing you left, right and centre, trying to get you in. We cannot waste a drop. So if you don't want that vaccine, please, please, please tell us. So somebody else says, will my 80-year-old parents be vaccinated at the same time on the same day? Thank you. Well, we have ordered the vaccinations in alphabetical order. Therefore, we're hoping that people who live together with the same surname are together. If it's not and it's convenient to you, please let us know once you get the timings. If indeed there's 5, 10, 15 minutes apart, please don't do that. Just come along at the same time and we'll do our best if they're willing to wait. If not, then please just come at your time and wait in the car accordingly. But I can't guarantee what's happening with that. We've got to make sure that everybody gets vaccinated. Now, the other important thing with our cohort is to remind you that every single over 80-year-old will be vaccinated that weekend. In some respects, our smaller numbers actually work for us, that we haven't had to pick which over 80-year-olds, which patients in this cohort have to be vaccinated this weekend. We don't need to make that choice because we only have, well, we have sufficient vaccine for everybody to be offered it. That is a roaring success, and we don't have to kind of make those decisions because you're all going to have it. Okay, next question. We drove over today to see where the immunisation centre was. Unless there are 2 medical centres in Larkhill, the parking was around the back, but there appear to be very few spaces available. There is parking for 300 people. I am worried about where you went today to find out what the centre is. There is masses and masses of car parking. So I'm a little bit concerned. I think you need to check where you went. There are indeed 2 car parks. One is a staffing car park. So if you went to that one by accident, you might find there weren't any spaces. Okay. Oh, sorry, there are 3 car parks, 2 of which, no, one of them are staffing and the rest is for everybody else. So if you went to the one staffing car park, then indeed there probably isn't very many spaces left. But if you've gone to the patient ones, there should have been masses to be able to do that. So Davini Cooks asked a really, really good question. I have received an NHS text message from a friend saying how important it is to have your NHS number with you. Should this be passed on to patients? No. And the reason being is that we know your NHS number because you are registered with us. So if you were going to a mass vaccination centre, yes, I would advise that you make sure that you have your NHS number with you. But we already know your NHS number, so we'll be using that to register you onto Pinnacle. So do not worry. Just turn up. Okay, so somebody says, I'm sorry I missed the beginning because it crashed on me. As anyone a start date. So I'm hopefully, from all I've spoken about, you know that we're vaccinating on the 16th and 17th of January, and it's only the over 80s. I don't know how old you are as to whether or not you're able to attend that session or not, but if you are over 80, you will receive a letter. OK, I'm only 42 and on immunosuppressants. Do you know when we are going to be considered? Now, the meeting that we had last week and all the previous ones talks about cohort. I realise that the one from Monday hasn't been uploaded as yet. We are in the in progress with that one. We've just been inundated with the vaccine programme to make sure that we launch. Now, once that's in there, I would suggest that you watch those. That will tell you all the information, and you'll hear the doctors answering questions about who's in which cohort. Now, there's a good question about the difference between the AstraZeneca vaccine and the Pfizer vaccine. Please, I want to reiterate, this weekend we are offering the Pfizer vaccine. Now, if somebody is allergic to any components of that Pfizer vaccine, you will not receive it. You will leave, not being vaccinated, and we will contact you to provide the AstraZeneca vaccine. OK, but bear with us. Please remember that when that Pfizer vaccine arrives, we have 120 hours to use it. Our full focus will be on that, and then we will look at using our AstraZeneca vaccine to vaccinate anybody who was allergic to the Pfizer vaccine during our weekend of the 16th and 17th. Also, our AstraZeneca vaccine will be used to vaccinate patients in care homes because we can't move the Pfizer vaccine around. So our AstraZeneca vaccine will be allocated to our most vulnerable patients who are in care homes. And I'm sure you'll all agree from the news that that's absolutely imperative. Richard has asked about working with other practices. Indeed, I hope I've made it clear we're working with Avon Valley Practice and Sarum Health Group. As yet, well, we're working together as a PCN, which we've talked about in all of our other meetings, OK, to be able to do that. At the moment, PCNs are not working together because we all had to allocate hubs to be able to work from to vaccinate. So at the moment, we are only working in our one PCN grouping. There's a question about reactions to second dosing. I'm not in a position to answer that. I'm not a clinician. My doctors are all seeing patients. So if you can keep that question to the next live Q&A when I have a doctor in, that would be awesome. Right, so somebody else has asked about the interval of the second dosing. So as I go back from last Monday's meeting, when we confirmed that the date is going from 3 weeks for repeat to 10 weeks. Indeed, you will be giving consent to have your second dosing within the next 12 weeks. That is the requirement, OK? However, locally, the NHS standard has been agreed that you will be invited in 10 weeks' time. So plan it in your diary. You will be coming back for your vaccine in 10 weeks' time. Now, just looking at my diary, let me just check when that's going to be. So that's 1, 2, 3, or 1, 2, 3, 4, 6, 7, 8, 9, 10. So that's the 27th of March and the 28th of March. And you would have thought I could have remembered that from all the times I've looked at it. But indeed, with the heat at the moment, I couldn't. But it is the 27th and the 28th of March. So please plan for attending your appointment on those days. Now, Richard Scott's asked about whether or not we need some more volunteers. And indeed, please can I come back to you on Tuesday or Wednesday of next week once I know if we've got any gaps. The military have been absolutely superb in their commitment to support us as well. So we just are working with them at the same time. However, we do know that we need volunteers, and as much help from the local community is much appreciated. We've had a great amount of support so far. So let's find out what they can do first, and then I'll let you know if we've got any gaps. Now, this is really good. Somebody has told us about the scam that's going on about people being approached to pay £160 to get a vaccination. Please, please, please don't let anybody follow it. This is a free injection. Promise you, OK? So please get the word out that it is free on the NHS. Do not be scammed. There's another question about being clinically extremely vulnerable and what to do. So as we talked about on Monday, the people who are clinically extremely vulnerable have now been escalated in the cohort. So they are now part of cohort 2. So cohort 2 includes patients who are clinically extremely vulnerable, regardless of age, and patients aged 75 to 79. So that's our cohort for, well, that's our group for cohort 2. So once we get that vaccine, we'll be coming out to you to book those appointments accordingly. Okay, so watch this space. And somebody else has asked about them being a dental nurse and can they get the vaccine? Absolutely, they can. They are now deemed as frontline staff. Now, their employers should be organising that. Okay, however, if she is a patient of ours, okay, please can you put in the private chat, we won't publish it, then your name, okay, and we will contact you. I will have to check that you are eligible, as in you are who you say you are, which I don't doubt, but let's face it, if people are going to scam and try and say that people have to pay £160 for a vaccine, people will pretend that they work for frontline, NHS services to get this vaccine. So I will just need to check and verify that who your employer is, but if you can give all of that to me, then we can do that and get you vaccinated. Okay, so I'm just going to move to the bottom now to find out anything else. So here we are. I was supposed to Google Street View map of the screenshot of the COVID vaccine centre in the surgery website. Yep, okay, great. Somebody's asked for a map about where we are, okay, on Google Maps. So Stuart, who's our IT guru, as you know, will sort that out for next week and get that out. Okay, so yeah, no problem at all. So somebody's asked about how many weeks will it take you to get through the over 80 cohort? So we'll do that, as I said, all on this weekend. Everybody will be, all of cohort 1 will be completed, if they are, of course, all well, this weekend. Okay, so we will be moving on to cohort 2 as soon as we get the next lot of vaccine. I agree, car park signage isn't very good. Okay, I agree that. Unfortunately, at the moment, I can't change that right now, but go down Willoughby Road. Willoughby Road, you will be able to find. The car park is on the left. It is huge. I absolutely promise you, you can't miss it. It's massive. Okay. There will also remember that when you come, unless you'll be in the first ones at 9 o'clock, there will be people in the car parks. There will be people walking about because there'll be a flow of people going in to have their vaccine and also leaving having had their vaccine. So please, do not worry, I'm sure you can find us to be able to do that. Somebody else has asked about an allergic reaction to penicillin. Dr. Chet and Dr. Green confirmed previously that penicillin, an allergy to penicillin, is not a reason not to have the Pfizer vaccine. So on that, just on that allergy, it would still be okay for you to have the Pfizer vaccine. Now somebody has asked whether or not the vaccine can be given at home. We are asking everybody to make every effort to get into the surgery. We need to be able to vaccinate you, okay? We appreciate that that can be difficult to look at. Now I'm just getting a message accordingly. Oh, do you want to put a map on the screen of, so Stuart's just asked, do we want him to put a map of the building on the screen? I say yes. Get that ready, Stuart. Right, I'll carry on answering the questions. Okay, so what's happened? Oh, it's just taken it down. Oh my goodness, I thought we were going to be cut off then. Goodness. Okay, so here we are. Here's the map. So you are going to be driving down pretty much, probably the majority of you, through the Packway, as you can see. Okay, so the Packway is distinguished by shops on the right, as Durrington is behind you, and a school on your left. Okay, so you are driving down the main Packway in Lark Hill. So as Stuart's now pointing, you can see that big primary school. You keep going and you go past the Sharp Hall on your right. Okay, and then you turn left down Willoughby Road. Now this is quite a difficult kind of map to see because it's not exactly clear where everything is, but you will be going down Willoughby Road and turning right into the car park. And can you see this huge space? It's like an L shape round of car parking. That is all around in terms of in different places where you can park. So please park in there, and that'll be great. And you'll be walking through the pathway so you can see where we're going to be. All right. Hopefully that's okay. So I'm going to leave the map up for you to have another look at while I carry on. Oh, it's disappeared. But Stuart will put the map back up just while I answer some more questions. So somebody's asked about key workers receive an invite. You've been asked by the PCT, which is now the CCG. Call me as a key worker, as I've been asked to get my staff details to the PCT today. So yes, if you need to do that, but what I'm saying is if patients are registered with us and are healthcare workers, and you know that, and talk to your employers and they haven't made other arrangements for you, you can drop me a line. I can't guarantee it, but if I can, I will vaccinate you. Okay, somebody's asking about their father getting access into the centre, and we can organise a wheelchair. I have been given the okay to do that, but just remember it is a long way, so wait till you get the letter, consider that, and we can go from there. But I can't really answer that question, it's quite personal. Like I said, we keep trying to get as many people in to the surgery as we possibly can. Okay, so somebody said about that they're worried about the toilet facilities. We do have toilet facilities, and if you go back to the map, okay, it is in the waiting room, but of course it's at the exit, it's not at the entrance. Now, the other toilets that are available, they are available in the clinical area. However, we have to be aware of the number of people and what is happening. Also, in terms of the fact that we don't really want you going to the toilet within the 15 minutes of you having the vaccine. We need to observe you the whole time. You do not want to have an anaphylactic shock in the toilet while you're on your own. So this is why we're saying, please try not to need the toilet while you're with us. Make every effort. I know if you get caught short, you get caught short. I understand that, but it would be wrong of us to say it's no problem at all. Okay, be aware that there is a toilet in the clinical area. We have allocated it for workforce. However, the patient toilet is at the exit, not the entrance like it usually is, to be able to do that. Okay, so I understand that, but what, you know, unfortunately we have what we have at the moment. Okay, so in total we are using, we're asking for 76 volunteers in total for the whole weekend, 19 volunteers per clinic, and that's to make sure that we have enough people. So I'm actually just going to recap where these volunteers are going to be. So first of all, there's going to be 3 volunteers at the entrance. Those people are going to be checking your temperatures, asking you if you have any COVID symptoms, and a couple of other jobs as well. So they'll be doing that at the entrance. They'll then be guiding patients through into the check-in area, in queues to be able to get through, and meeting the next marshal, who is at point number 3, who is there waiting near to the first vaccine area, who will be guiding you to the next available vaccination chair. Whichever one is available next, you will be guided to. On your way out, because the vaccinator will ask you to leave, on your way out, there'll be another marshal or steward, okay, advising you where to go into the waiting room. And there will be 3 stewards on duty in the waiting room monitoring you, okay. They will be replaying the video. They will be wiping down the kitchen timers on your, once they beep. And they'll be making sure that you don't leave before those beepers go off. And I know that sounds difficult, and I know that for most of you probably listening to me say, no, oh my goodness, of course I would stay. And I understand that, but there are some people that really don't want to, and we will need to try and convince them to stay with us. And as you leave the building, there are currently going to be 4 volunteers helping people to leave the building safely. So we're hoping that's enough. So that's 19 volunteers per clinic. Okay, and we've got 4 clinics in total, so that's 76. Right, let's just have another look at these questions. Let's go back to them. Somebody said you didn't answer whether I can take my father in. Well, you can bring your father in, but of course this is a personal question that you've got, and I don't think it's appropriate for me to answer it live in front of lots of people. Indeed, I don't know how many people are on the call, but without knowing who your father is, what the situation is, then we can't make a decision on that. So somebody else has said that they're a carer for their mum who's going to be bringing their mum for vaccination on the 16th, 17th. Can they be vaccinated? No, I'm really sorry. It's very clear. The guidance is that we are only allowed to vaccinate people who fall within cohort 1 to be able to do this. So we've got, please can you confirm how many patients you have in each cohort to be able to do that? I will publish out the numbers because they keep changing as people register, move away, etc. So I will release that information again in terms of that. We have only been concentrating on cohort 1. We do also know that once the vaccination centre goes live in Salisbury, of course, the speed will get on. So you can't really gauge that as an idea about when we're going to be vaccinated to be able to do that, but we will get that through. Please, can you well, let's have a look at this. Okay. So can you please answer the very first question raised by Jeanette Bishop? Let me have a look. Okay, so I think I have answered that question, and that is that if you're clinically extremely vulnerable, you are going to be in cohort 2. So I have suggested that. Now your husband, who is in 71, is going to be in cohort 3. At the moment, we're not given any leeway to change the cohorts. So indeed, he will still be in cohort 3, even though you are in cohort 2. Okay, allergies. What allergies prevent you from having the Pfizer vaccine? Okay, so the only allergies that I'm aware of that prevent you from having the Pfizer vaccine are the constituents of that vaccine. Okay, I can't give you any more information than that because I'm not clinical. Like I said at the beginning, I can't answer any clinical questions because the GPs are seeing patients and there's no one with me. Okay, so it is just me tonight, and make sure that you've got that. But that will all go through, the vaccinator will go through those things with you when you have your vaccine. So we've got another question. So currently 2 people are going to be 80 in 6 weeks' time. When are you included in the over 80s? No, you're not, because you're age 79. I'm really sorry, there is just that cut-off. Can my wife, who is 71, be vaccinated at the same time as me? Mr. Norris, I don't know how old you are. If you are indeed age 70 to 74, then yes, you will be vaccinated at the same time. If indeed you are in cohort 2 or cohort 3, then no, you won't. You will be vaccinated first. Somebody else has asked that their daughter's a pharmacy technician. What cohort will she be in? Okay, pharmacy technicians, some are patient facing, some are not. If she is patient facing, as in she sees patients on a day-to-day basis, she will be vaccinated. If she doesn't, then she won't be vaccinated yet. She'll be in her age cohort. So somebody else says he's due to have a spinal surgery in the next 6 weeks. He's 70 in March. Is he still able to get the vaccination? As far as I know, and I don't know, I would hope that you're going to have the vaccine in the next 6 weeks if we get through the cohorts, because you will be, well, basically, actually, no, I don't know your age. Really sorry. I don't know your age, so I can't comment any further on that. Okay, let me have a look. I think I'm answering all the questions so far. Okay, is it okay to drive there and home? So yes, it is. We've been told that as long as you wait 15 minutes. Every single person must wait 15 minutes. So you can drive in, you have your vaccine, you have to wait 15 minutes, and then you should be able to return to normal activities. Okay, somebody else has said, as I'm shielded, how will I get my vaccination? You will need to attend the surgery. So you will be in cohort 2 because shielding means that you are clinically extremely vulnerable. So therefore you will be invited in cohort 2 into the surgery. Now, I've getting to the point that I think I've answered all the questions. So let's just have another look through those that have gone through, I think. And so, of course, a very good question here is, if you miss your appointment, what happens? Okay, so for cohort 1, if you miss your appointment for any reason, let's say you're unwell, okay, you will be given an appointment for your at the next clinic. Okay, that's what we will do for you to be able to do that. And we will know that you haven't had the vaccine, so you'll need to wait like everybody else does, and we will contact you to say, well, to invite you to attend. So please don't worry, if you miss your appointment, we will still contact you when we get more vaccine. Okay, so hopefully that will be all right. Now, I feel like I've said okay a lot of times this evening, so I am really, really sorry if that's come across too many times. So let's see, any more questions? So thank you for all the thanks, that's lovely. What I would just say is mobilise. If you can help anybody get to the surgery, that would be great. We can't give you any personal details, of course, but remember there is the link service that you can volunteer for, which I'm sure will be very appreciative if they're allowed to under the COVID pandemic transport people. That I don't know, but I do know that's a very good service that a lot of patients rely on. Oh, okay, another good point. Somebody said, please point out that the medical centre is the new building and not the old one being refurbished. Okay, absolutely. Do not go to the old building. Please, please, please come to the brand new spanking huge building that is there in front of you. It is a glorious building. It is a lovely layout. Okay, there is lots and lots of space. So you will be able to socially distance. We will keep you safe. All staff or everybody working, volunteers and staff, will be wearing surgical masks. Okay, they won't just be wearing normal masks, they will be fully protected. So please bear with us. We will do everything we can. We are following all infection control processes, and we're confident that we've got that in hand. Okay, so that seems to be the end of the questions to be able to have to answer. So I hope that I've kind of done what needs to do. Can we just leave? Stuart, can you pop up the patient flow again? Because I just want to recap on that to make sure that everybody is clear. And like I've said, the other important point is that if anybody doesn't get their letter who's aged 80 or over by Thursday, please contact us. You do have an appointment, absolutely. You just don't know when it is. Okay, so, oh goodness, I just said okay again. Right. Moving through this, so I'm going to leave you with this plan on the board so you can see it. You will be coming into or entering the building on the left-hand side through the fire exit. There will be marshals there to greet you, and they will be undertaking a COVID screening test, okay, or check, should I say, of thermometer and questions. You will then walk the way through the building, and where you will check in, and an administrator will be registering you on the Pinnacle system, where we will be recording that vaccine. Okay, we will be marking you as arrived so that we don't keep chasing you and asking, are you here? Are you here? You will then move into the vaccination area, where you will be asked to sit on a chair in the doorway. This enables the clinicians to spend minimal time cleaning between patients, because actually you have minimal amount of contact, so we will clean everywhere that you sit and touch. The vaccines will be delivered in these rooms by trained vaccinators under what's called a PGD. There will also be an administrator present who will be data recording what is happening, and they will be pressing save as you leave the room. Now that's really good, because that means that overnight your medical record will be updated, And that means that then the next day, everybody will know that you've had your first COVID vaccine. You walk through from there with your kitchen timer, remember, counting down 15 minutes, and you will sit in the waiting room. And once you're sitting in the waiting room, I know it's 15 minutes, but you need to stay there, okay? And you will be watching a video just to pass the time that will recap on all the information that you've been given during your time with us from entering the building. And then you will exit out of the building through our normal, what is entrance from reception, out and back into the car park. So I really hope that you understand the flow, that you can share that, and we're hoping that this does work well so that actually we'll use it again for our next cohort of patients. Now, bear with, because actually we might find, we will learn through this process. This is the first one. We may well change it. However, it will only be changed because actually something goes wrong, or actually we know how to make it slicker and better for you. So bear with us on Saturday and Sunday. We will all be a little bit nervous, as probably you will be, having this vaccine, but it's imperative. So take care, and we will see you on Saturday. And like I said, make sure that if you haven't got your vaccine, your letter by Thursday, and you're aged 80 and over, please let me know. Okay, contact the surgery and find out, and the receptionist will be able to tell you when your appointment is. But if you've had your letter, there is no further action for you to take other than to arrive at the right time for your appointment and following our top tips. So take care, okay? We will be back in touch after this, after cohort 1's vaccination programme, okay, to talk about what has happened and how we got on. And like I said, if we need any more volunteers, I will be calling out to you to say, can anybody help? Can anybody help? Okay. And even if it's not this time, next time. But for now, I'll say good night and have a really good weekend. Take care.